Major body systems in gross anatomy. Major body systems in gross anatomy. Introduction. Gross anatomy studies the macroscopic structures of the human body, those visible to the naked eye. For systematic understanding, the human body is organized into body systems, each made up of organs that work together to perform specific physiological functions. Although studied separately, all systems are structurally and functionally interrelated. The major body systems in gross anatomy include 1. Integumentary system, 2. Skeletal system, 3. Muscular system, 4. Nervous system, 5. Cardiovascular system, 6. Respiratory system, 7. Digestive system, 8. Urinary system, 9. Reproductive system, 10. Endocrine system, 11. Lymphatic, immune system. 1. Integumentary system components. Skin, epidermis and dermis. Hair, nails, sweat, sudoriferous glands. Sebaceous glands. Gross anatomical features. Skin is the largest organ of the body. Thickness varies. Thin skin, eyelids versus thick skin, palms, soles. Rich blood supply and nerve endings. Functions: protection against physical injury, infection, and dehydration. Regulation of body temperature. Sensation, touch, pain, pressure. Vitamin D synthesis. Excretion through sweat. Clinical importance: burns, wounds, skin grafts. Route for drug administration. Transdermal patches. 2. Skeletal system components. 206 bones, cartilages, ligaments, joints divisions. Axial skeleton, skull, vertebral column, ribs, sternum. Appendicular skeleton, limbs, pectoral and pelvic girdles. Functions: support and shape of the body. Protection of vital organs, brain, heart, lungs. Movement with muscles. Hematopoiesis, blood formation. Mineral storage, calcium, phosphorus. Clinical importance: fractures, deformities, arthritis. Landmark identification in surgery and physical examination. 3. Muscular system. Types of muscles: skeletal muscle, voluntary, cardiac muscle, heart, smooth muscle, viscera, gross anatomy, focus, origin and insertion, action, innervation, blood supply, functions, movement and posture, heat production, circulation of blood, cardiac muscle, movement of contents in hollow organs. Clinical importance: paralysis, muscle injuries, intramuscular injections, sports medicine. 4. Nervous system divisions. Central nervous system, CNS. Brain, spinal cord. Peripheral nervous system, PNS. Cranial nerves, spinal nerves, gross anatomical structures. Cerebrum, cerebellum, brainstem, meninges, ventricular system. Major nerve plexuses. Functions: control and coordination. Sensory perception, motor control. Higher functions: memory, consciousness. Clinical importance: stroke, spinal cord injury, nerve damage and anesthesia. 5. Cardiovascular system components. Heart, blood, blood vessels, arteries, veins, capillaries. Gross anatomy of the heart. 4 chambers, 2 atria, 2 ventricles. Valves: tricuspid, mitral, pulmonary, aortic. Coronary circulation functions: transport of oxygen and nutrients, removal of waste products, regulation of body temperature, maintenance of blood pressure. Clinical importance: hypertension, heart failure, venipuncture and catheterization. 6. Respiratory system components. Nose and nasal cavity, pharynx, larynx, trachea, bronchi and lungs. Gross anatomy of lungs: right lung, 3 lobes, left lung, 2 lobes and cardiac notch. Functions: oxygen intake, carbon dioxide elimination, voice production, acid-base balance. Clinical importance: asthma, pneumonia, intubation and chest tube insertion. 7. Digestive system components. Mouth, esophagus, stomach, small intestine, duodenum, jejunum, ileum. Large intestine, liver, gallbladder, pancreas. Functions: ingestion of food, digestion and absorption, elimination of waste. Gross anatomical highlights: peritoneum and mesenteries, blood supply via celiac trunk, SMA, IMA clinical importance. Appendicitis, hernias, abdominal surgery, landmarks. 8. Urinary system components. Kidneys, ureters, urinary bladder, urethra. Gross anatomy. Kidneys are retroperitoneal, cortex and medulla. Renal pelvis. Functions: excretion of waste, regulation of fluid, electrolyte and pH balance. Blood pressure regulation, clinical importance. Kidney stones, urinary obstruction, catheterization. 9. Reproductive system, male system. Testes, epididymis, vas deferens, prostate, penis, female system, ovaries, fallopian tubes, uterus, vagina, external genitalia functions, production of gametes, hormone secretion, reproduction, clinical importance. Childbirth, infertility, gynecological and urological surgeries. 10. Endocrine system components. Pituitary gland, thyroid and parathyroids, adrenal glands, pancreas, endocrine part. Gonads. Functions: hormonal regulation of growth, metabolism, and reproduction. Clinical importance: diabetes mellitus, thyroid disorders, hormonal imbalances. 11. Lymphatic, immune system components. Lymph nodes, lymphatic vessels, spleen, thymus, tonsils. Functions: immune defense, fluid balance, absorption of fats. Clinical importance: spread of infection and cancer, lymph node enlargement. Conclusion. In gross anatomy, the major body systems provide a framework for understanding the structure of the human body. Each system has unique anatomical features, but functions in close integration with others. Mastery of these systems is essential for clinical practice, surgery, diagnostics, and healthcare education.